Styes are infected bumps that pop up on the eyelid. The medical term for them is a hordeolum, and boy are they painful and annoying. I've seen an increase in styes ever since we all started wearing masks in 2020. In today's video, I'll go over my go-to at-home stye tips to get rid of yours fast, as well as cover what your doctor has in their bag of tricks as far as stye treatment. Welcome to Eye School with Dr. D, where my goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every week. You've made it to Eye School with me, Dr. D. Welcome! Today we're getting rid of that terrible stye that's popped up on your eyelid. Before we get started, this channel is all about eye education, and I love creating this community of pupils. I've created an Eye School with Dr. D account over on Instagram, so make sure to follow me over there for infographics, behind the scenes, and more. So you've got a stye. They're a common occurrence and can happen to anyone for seemingly no reason at all. Styes are simply an infection and inflammation within one of your meibomian glands. Styes can happen if you touch your lid with bacteria on your hands, if dust blows up in your face, or even just randomly. I got one time at an antique shop, so they definitely just happen. Usually in patients who have recurrent styes, however, there is underlying lid disease like blepharitis or meibomian gland dysfunction. That's where I'm supposed to put the link, not before. When you have a stye, it's important to take care of it swiftly in order to get it to fully go away. In my clinical experience, the longer it's allowed to go on, the more inflammatory debris builds up, and the chances increase that even once that stye or the infection is gone, once that's healed, the inflammatory debris won't completely clear, and you'll be left with a chalazion. So chalazions are when that inflammatory debris is still in there, you still have a bump, but it's not hot and red and painful anymore. In addition, styes can easily turn into preseptal cellulitis, and so it's very important to take care of them very, very quickly. My advice overall is to bring your eye doctor in the loop. But let's say it popped up after hours or on the weekend, or you're out of town and you're looking for a quick at-home treatment. The first treatment that helps a new stye is heat, as much as possible, as often as possible. If you have a Bruder or Optase compress at home, use one of those and aim to use it in 15-minute increments 3 to 4 times a day. Now there's lots of, if you search the internet, they'll talk about warm green tea bags. I personally don't recommend tea bags at all. You can also use a small potato or an egg. Right, so I actually have recommended this in the past. If you boil an egg, it'll get nice and hot. You can wrap it in a dish towel, a clean dish towel, and apply that to your eyelid just kind of continuously throughout the day. It's just going to stay so hot so long that it's very, very useful for a stye. And plus, there's always the joke that you can make a potato salad when you're done. So, bonus. There's a fly. Over-the-counter remedies like this one exist. So I'm going to put this up on the screen. But this is this brand is Stye brand, and it's advertised as an eye ointment, and that's exactly what it does appear to be. It contains mineral oil and white petroleum, which are both emollients and lubricants. The second common over-the-counter medicine I hear about a lot is the Similacin version. This brand aims to treat styes with natural ingredients. So one positive of this brand is they do not contain vasoconstrictors like other get the red out drops will. They list their active ingredient as Conium maculatum, which is actually a poisonous plant that's also considered an invasive weed. I don't know the mechanism by which it's helpful with styes. However, I was able to find an article from 1870 on the plant. It talked about its peculiar ability to alter profoundly the structure of various parts of the body, including the cornea. I've had patients that swear by these Similacin drops, but they're not something that I actively recommend. Another piece of advice if you have a stye is to avoid contact lenses and makeup, and in fact, you're probably gonna have to throw away your eyeliner and mascara after this episode. Next, we've got lid wipes. So you guys know I like lid wipes for many reasons. In the case of blepharitis, meibomian gland dysfunction, dry eye, I've made videos about that. I'll link at least one up here. I also find them very useful when my patients have a stye, and I recommend cleaning that affected area 3 times a day with a lid wipe. Tea tree oil, as we've discussed on this channel, throw it up there, can be controversial because of one recent study in 2020 showing that it has a toxic effect on the meibomian glands. But typically this is a case where I will have patients use wipes with tea tree oil because reducing the bacterial load over a short duration of treatment is very important, and to me outweighs the risk factor of harming those meibomian glands over time. Now, these treatments are really the extent of what can be done at home without a doctor or a prescription. Warm compresses, cleaning the lids, artificial tears, and possibly an over-the-counter Stye product. So just for completeness today, I know this is an at-home remedy video, but we'll talk a little bit about the in-office treatments you might be in for if that Stye isn't going away. First, we've got drops and ointments. Your doctor might do a topical ocular therapy like an antibiotic or a steroid. So they could prescribe a topical steroid, a topical antibiotic, or both. They might do it in a drop form, an ointment form. I think all of those are pretty common and effective. These are gonna help stop the infection as well as reduce the swelling and the inflammation that's happening. You could be on these drops anywhere from about 1 to 3 weeks. I tell patients that the Stye should start to get better fairly quickly and to return to clinic sooner if there's any change in RSVP. RSVP stands for redness, sensitivity to light, vision changes, or pain. The second thing your doctor might put you on are oral antibiotics. If the Stye is large or affecting more than one gland, or even if it's starting to travel along the lids and become suspicious for preseptal cellulitis, your doctor might prescribe you some oral antibiotics. Expect at least a 7 to 10 day course. I often use Keflex or Augmentin. I found that both work nicely to clear up the Stye, but if you have allergies to certain antibiotics, definitely tell your doctor, obviously, and there are other medications that can be used as well. Finally, you've heard me talk about it in the context of dry eye, but IPL or intense pulse light is a great option for Stye and chalazia as well. I'll link my IPL video right here. But this is because IPL clears Demodex mites, reduces inflammation, and works to kill bacteria. I've been doing IPL on my patients with Styes and with chalazia, and even just 1 or 2 treatments, we can get that Stye gone right away and not be left with this lingering inflammation within the gland that needs surgery. The other 2 treatments for Stye or chalazion, once it's not infected anymore, are injections of steroids. So your optometrist or ophthalmologist may inject a steroid right there by the Stye to help it go away. Or you may have to go for surgery. Now, I've had that surgery myself. It's an in-office procedure. They flip your eyelid and they basically cut open the meibomian gland, taking out all that inflammatory material. I don't like it to get to surgery. That's why I say it's so important to start treatment right away, because once you lose meibomian glands, they're gone forever. And so when you do surgery on them, there's a high chance that you'll lose not just one, but maybe even several glands. And we want you to keep all your glands functioning and healthy to avoid having tear film dysfunction, i.e. dry eye. So have you ever had a Stye? Let me know what you did to resolve it below. That's it for today's iSchool lesson. I will see you next time. Class is dismissed.